So when I first started out, I started in employee health and found that it was a great basis for what I needed to know in infection control. And it also taught me a lot about people and professionals in particular, and kind of what was realistic for them and so forth. So anyway, I want to talk about some key elements for an effective employee health program in an ambulatory surgical setting. Review infectious diseases that have significant risk for your healthcare personnel, some basic prevention and follow-up measures, and some useful resources. Now, you'll notice that nowhere in here do I say what it is you're to teach your employees. So I'm going to try to cover that as I go through each thing, but there are some things that are required, that are mandated, that employees be aware of or know about. So as I talk about these different diseases, I'll bring that up. But as far as how you want to accomplish that, there are a variety of ways to do it. So anyway, so we'll get going here. So getting lots of discussion about that, and I'm sorry, there just won't be time to spend a lot on it, but one of the things that I do want to point out to you is you are not required to do 100% skin testing every year on your employees if you don't live in a high-risk setting for TB or work in a high-risk setting. So I was talking to some folks earlier about it. There's an excellent algorithm that the CDC puts out. It's for hospitals, it's for alternative care settings, it's for outpatient settings, it's for shelters. You choose whichever one fits your type of facility, and you just fill in the blanks on how many cases were seen in the community surrounding your facility in the last year. And you get that from the local health department. They can tell you, what's the population in this area and so forth. And essentially you work all the way through it, and how many patients did you see in your facility that you knew had TB? Maybe you didn't know you had anybody with TB in there. That's fine, it's a big zero. Well, how many employees have you had convert their skin test? How many people do you have come work for you with positive skin tests? And there's just a series of questions. And then at the very end of all this, you figure it all out and get down to the bottom, and you'll either fall into a very low risk, a medium risk, or a high risk. If you're in high risk, then they're going to say you need to skin test all of your staff every year and on a regular basis, maybe even more frequently than once a year. Do you have any questions?
Could you speak to shingles? You talked about chickenpox, but speak to the shingles and restrictions that might be associated.
Shingles in a healthcare worker, typically if they're a healthy person, generally healthy, then they'll remain localized. So they'll only be in one or maybe two dermatomes. Typically what I've seen, they're around the waist or maybe on the buttock. As long as the lesions can be covered and whatever might be leaking from the vesicles doesn't come through the clothing, so a light dressing or something to keep it from draining through the clothing, they're safe to work. As long as they've been counseled about their hand hygiene and they can stand the pain and continue to work. Now if they've got shingles on the face, that'll get a little trickier, and they're probably going to be so sick they're not going to be able to work. But generally it's a matter of being able to cover and contain. Now, we wouldn't allow people to work in our neonatal intensive care unit if they had shingles. They had to not work with the preemie infants, but otherwise we would allow them to work. Okay.
Good afternoon. We're at the last session of our seminar. My name's Mary Bennett. I'm a registered nurse. I'm certified in infection control and epidemiology, and I'm the director of infection control at Excellencia Advisory Group. Today we're going to talk about patient education. The surveyors do want to see what type of training you've had about how to educate your patients, the type of training that you have been trained. And we're going to address this in basically three sections, if you will. First, we're going to review the fundamentals of patient education, so that might feel a little bit like, nursing school 101 a little bit. Then we're going to talk, secondly, about some specifics about patient education and what we want to actually teach our patients. And then last of all, We're going to talk about some methods and resources and how to make really good use of our time when we provide our patient education. Some other things, infection prevention strategies that we can teach our patients would be hand hygiene. And in one study, except for their bathing or showering experience, the average person washed their hands 2.7 times a day, and that's just not enough if they have a surgical incision or a surgical site. So they need to learn to wash their hands more frequently. We need to teach our patients the modes of transmissions of organisms from one body area to another, and also what the portals of entry are for organisms to get into the body. And certainly their surgical site is one of those portals of entry. So we want to teach them how to avoid cross-contaminating their surgical site. We want to teach our patients to do hand hygiene before and after they care for their surgical site, and how to properly dispose of dressings and the other contaminated items, to put them into a lined trash container. If there's small children in the house, they might want to put those in a plastic bag and tie them up before they throw them out. Patients need to learn coughing and deep breathing techniques, but they also need to know to cover their cough and wash their hands.